all of you. I'm Dr. Mishra, a cardiac surgeon at the Bombay Hospital. I must thank this organization, the world's first, the world's largest self-help library for the people, for giving me this opportunity to come here and speak to these distinguished gatherings. I'm not going to talk much, but there is something, because I'm a cardiac surgeon, my aim is to let the people know what are the myths and concerns of the common man when one of your relatives or distant friend goes for a heart surgery. That was my main concern, to let the people be aware of that. So I'll be talking on this particular issue. However, formerly I was attached to the Cleveland Clinic, United States of America, Royal Prince Alfred Hospital, Australia, and I was the chief surgeon at the cardiac center in Dhaka some time back. Presently I am attached to the Bridge Hospital, Candy, and the Bombay Hospital. There are two hospitals in the city of the Bombay. And my main aim is to talk about the issues with the people concerned regarding cardiac surgery. But before that, I will tell a bit of the cardiac surgery as such, or the heart disease as such. So what is the magnitude of the problem of the cardiac? About 6 to 13%, that means approximately 10% of the persons in this society are having heart disease, maybe 15%, but that is the average thing. And in the rural population, it is half of the common, because of the stress associated with our present day life. It is more in our place, in the cities or metros, but it is just half the incidence what you get here. And cardiovascular disease has reached an epidemic in this country, or so far this Southeast Asian region. And about 3 million deaths occur each year because of that. I will come to a better data. I would like to put this, there is a report from the World Health Organization that by 2030, cardiovascular will be the main cause of death throughout India as a whole. This is a report from the World Health Organization. For more than 35% of the mortality rate. At the moment, there are different diseases which contribute, but by 2030, the death from the heart disease itself will be more than 35%. Out of the 100 people dying in the country, 35 will be, more than 35 will be because of the heart disease as such, cardiac accidents, malaria, and infant mortality, and all those things. So what I mean to say, the emphasis is the magnitude of the problem is very high. And again, there is a report from the World Health Organization only, that the premature deaths due to heart disease, stroke, diabetics are projected to increase the cumulative, and India's financial loss due to cardiovascular disease are estimated at US 237 billion for the period 2005 to 15. 237 billion for this period, for 10 years. Furthermore, because the majority of deaths occur premature, there is a substantial loss of lives during the peak productive year. It happens very younger age in this country. The potentially productive years of life lost due to cardiovascular disease among those aged 35 to 64, this is the most productive age, was 9.2 million in 2000 and is expected to rise to 18 million by 2030. This is a loss, and more than those losses predicted by, more than that loss is more than those predicted for China, Russia, United States, Portugal, South Africa combined. The loss in these countries which I have named, China, Russia, United States, Portugal, and South Africa combined, is 16.2 million. But in India alone, it is going to be 17.9 million. This is a report from the World Health Organization. This is a very, significant matter. So that's the concern. And for an average memory, we must say that then India has 15 million cases of the CAD, maybe around 20. So this is older data. I don't have the access to the present data. Around 20 million cases of the heart disease are there in this country. And about 10 to 15 Indian has coronary artery disease. About 15% of the person, out of 100%, every 15% will be having this disease. And every minute, 2 people die of heart attack in this country. We know that life expectancy earlier was 46 years, long time back. At the moment, the life expectancy is somewhere around 70 in this country, or 76. And worldwide, around 30% of death occur due to cardiovascular disease. And out of those, 20% is contributed by India as such. Coming to some amount of the data, about 1 lakh open heart surgery is happening in this country every year, for such, which is very less for the vast majority of the population which we are having. But what is the cause? This is all because of scams and all those things. We are having the shortage of everything. We have a very huge population, poverty, ignorance, and government priorities are the main reason why we are not able to provide this sufficient health care to our population. Little bit of cardiac surgery, because I am a surgeon, so I will tell little bit of cardiac surgery. Cardiac surgery, there are only 2 types. One is open heart surgery and other is closed heart surgery. Open heart surgery means where heart is stopped and a heart lung machine is used during operation. Closed heart surgery, where heart is beating and the operation is done. See, in the year 1925, nobody used to touch the heart, because the moment you touch the heart, you'll be penalized by the present, those days organization, because touching the heart used to be a sin those days in 1925. But after that, in 1925, people realized, heart disease are also treated and they are curable. But the problem is, gallbladder surgery, it is very easy, but the heart surgery is a bit different, because the heart is constantly beating, and the moment it stops, it means death. So that was the major problem when it did not happen earlier. So how to manage? See, the moment the heart stops, people will, someone who is having his heart will die. So the way to do operation was to use the something which initially was used as for a child operation. His mother's blood was used. He was made dependent on the mother. But subsequently there a lot of research happened, and ultimately there is a machine known as heart lung machine came, which revolutionized the entire open heart surgery era. And this is the man, DeBakey, who's credited with this, is from America. So all the things which you see, initially man saw how the balloon floats, how this, the birds fly, and then the idea came for aeroplane. Similarly, there a lot of thought came. This is the machine which is known as heart lung machine, and this is vital for the treatment of the heart surgery illness. But what happens if the blood is used for operation? It will clot. So you cannot do any operation unless you stop the blood from clotting. So there is a medicine known as heparin, which came in 1936, which made it, further the improvement. Later on, what happened? Because if they allow the blood not to clot, it will be of no use. It has to clot also, otherwise it will be of no use. So there is another medicine known as protamine which came, and all these things make the heart surgery very possible. So heart surgery is now done with the help of the heart lung machine, heparin and protamine. There are 4 things mainly in the heart surgery. One is CABG, which commonly people hear. The other is valve surgery, pediatric heart surgery, that means surgery for the children, and the aortic root for the aneurysm. They are the things There is closed surgery which I mentioned is when the heart is beating. That time surgery is done closed surgery. When the heart is stopped, we have to use the heart-lung machine. So that is the thing. Now the thing is, I wanted to tell you what is bypass surgery. In the bypass surgery, where is this thing? Stick. Do we have the stick? Okay, fine. I'll tell you one. See, please, there is a red mark is the block in the heart artery. There are 2 red marks. So the blood will not go below that. So if the blood does not go in the heart, it will suffer heart attack or angina, which is commonly known as chest pain. So the idea is to bypass that, and that was done with the help of it was done with the help of a operation known as bypass operation, which is the commonly called. Again, same thing. There are different ways to put the bypass. So usually what happens, how to say, what is bypass operation? Basically, when we find the road is blocked, we take a turn and reach the other side. Similarly, the blockage in the heart means there is a blockage, so we have to take another turn and bypass the things. Suppose there is a traffic jam at the metro, someone will come from the other side of the Charni road side. So that is the way. You have to take another road. Bypass means bypass the normal channel and supply the blood to the heart where it is required through an alternate channel. That is known as bypass operation. That is a very simple, though it is a bit complex, but I wanted to be precise like that. Anyway, so that is one thing, is bypass operation. Second thing is heart valve operations. You might have heard that some patients have undergone valve replacement because his heart valve was not working well. So that was a thing that heart valve operations. Basically, we replace the valve which is damaged and produce and supply a new valve which is made by the companies. There are 2 types of the valves which we use. The valves, one is tissue valve, another is mechanical valve. Tissue valve is which does not require medicine, but it does not last longer. Mechanical valve is one which requires medicine, but it lasts longer. There is problem with both the things. Nothing like God's given body. Whatever we do is always a patch material, or rakhu karte hain hum log. We cannot make what the God has given to us. It is simply not possible. And there is now, let me tell something about the children. Children get the disease like that VSD, BSD, ASD, TOF and PD. There are lots, but they are the common operations. Now I'll talk to what is the results of the CABG. CABG usually has got 1 to 2% problem, but there is no other as such problem. And once somebody undergoes a bypass operation, is virtually normal, provided he has been normal before that. If somebody has already been, his heart is completely damaged before operation, it cannot be made normal. But if somebody is normal before that, except that he is getting chest pain, he can be made normal after bypass operation, which is lifelong thing. Once bypass, it lasts for the lifelong. And the quality of life is normal. However, if there is a new block which happens at a later date, it may not be of the, it may require another intervention. But there is recently, you might have heard, there is a lot of things which is known as angioplasty, bypass and angioplasty, which is, so far all the stents are inferior to the bypass operation. And they are not long lasting. There are a lot of problems associated with those things. And after a stent, there is a problem with the heart attack as well. And which one is better, bypass or angioplasty?